Wales, Africa and the World, the podcast from Cymru Africa, championing global solidarity and the connections between Wales, Africa and beyond. My name is Peter Gilbey, and in today's episode, I'm pleased to welcome Israa Mohammed, an advanced epidemiological scientist, originally from Sudan, but now working at Public Health Wales, investigating trends in diseases and making sure Wales is prepared to respond to outbreaks. She has worked on infectious disease surveillance, outbreak investigations, and global health projects, including with the United Nations Development Programme on equitable vaccine access during the COVID-19 pandemic. Israa is also the new chair of Global Health Partnerships Cymru, promoting international health collaboration and supporting NHS Wales's global engagement. In today's episode, we'll be doing some discussion on the devastating civil war in Sudan, its impact on public health, and the role of global solidarity in responding to it. We'll also hear Israa's personal reflections on resilience, hope, and leadership in a time of crisis. Bore da, Israa.
Bore da, Pete.
So your career began in Sudan as a hospital and community pharmacist. Can you tell us a bit about that journey and what drew you into public health?
Yeah, my journey began quite traditionally in Sudan. I did study pharmacy and I worked both in hospital and community pharmacists. I did enjoy working as a pharmacist. I loved it. I loved interacting and helping patients. But then over time, I began to realize that I actually wanted to make a change at the population level. And this is what drew me to public health. I remember while doing the master's in clinical pharmacy, I was drawn into pharmacoepidemiology, and I loved the epidemiology. So I started to dig further, and then I did a diploma in public health, and I started to volunteer with local organizations such as Sudanese Red Crescent Society associations and Turkish Relief Association. So those experiences really opened my eyes into public health, and then I found myself in public health, doing a master in public health at the London School of Hygiene, Tropical Medicine, and being immersed in the pandemic epidemiology since then.
You've just touched on it a bit now. So in 2018, you won a scholarship to study at the London School of Hygiene and Tropical Medicine. In December of that same year, protests broke out across Sudan, and they were met with violence and conflict. You were actually in Khartoum at the time the conflict began. What are your reflections of that time?
Yeah, that feels like a while ago. I remember in June 2018 when I received the scholarship that I applied for. I didn't have so much expectations when I applied for the scholarship and the masters at the London School, and I had to defer my scholarship to the next year to complete my paperwork. I remember in December 2018 when the protest started in Adbara city in Sudan, and the demand was to reduce the cost of bread. And then it went on other cities, including Khartoum, where I lived. So at the start, my sister used to study law at the University of Khartoum, and she was very actively involved in politics, and she was very actively involved in the revolution itself. So she started going to protests, and then I started going with her to protect her, to be honest. I wasn't very hopeful that these protests will lead to any change. But then I found myself participating without my sister and, demanding the three basic things that people were asking for, the chants were very simple. People demanded freedom, peace and justice. Basic human rights, I would say. And if at the start it felt like a change was possible, but then we were faced with so much violence. We managed we could say, get rid of the dictatorship by the end of those protests. And what I do remember from those times is the unity. How different people from different parts of Sudan coming together just to demand the same basic three things that we all called for, and the support from everyone, the food that was shared by everyone, the water, and it was a lovely atmosphere during the protest.
As often happens, the oppressive measures used against these protesters turned even more violent, and even in revolutions, while often they may start off with some violence in response to difficulty, it is, as you say, a time of hope as well, particularly when you centre it around freedom and justice. It's now 7 years since the toppling of President al-Bashir, and the people of Sudan find themselves still suffering. In 2023, Sudan was plunged into a civil war, and the crisis that's followed is the largest humanitarian crisis the world has seen. The IPC recently said 20 months into the conflict, Sudan continues to slide into a widening famine crisis. 24 million people are living in acute hunger. 12 million people have had to flee their home. How did Sudan get here?
Yeah, after al-Bashir was removed from the government, Sudan entered a transitional period with civilian and military power sharing the government. It was very fragile from the start because the economic collapse was very obvious at that time, and the political instability worsened at that time, and also the mistrust threatened the progress. And one of the, would say, big mistakes is incorporating the RSF militia into military, and this is one of the main reasons actually behind the current war. In 2021, the military staged another coup, and the civilian government was dissolved at that time, and ending the promises of a peaceful transition. And then April 2023, again, the Sudanese military and the militia started to fight. And I remember the start of the war itself. Call it civil war, but there are different parties involved outside Sudan, and we'll talk about it later. But I remember when the war started, reflecting on my personal experience, going to Sudan for a holiday, surprising my family, and then I stayed at home for 1 week because I had some sinusitis, and then just the nights before the war, this is when I started to go out and do things with my siblings. I remember driving and going to my favorite ice cream place in one of the main roads in Sudan, and everything felt very normal. And then I went to a cafe after that, and everything felt really fine. We returned home around midnight. And then we had a late dinner, very late dinner, because it was during Ramadan, the fasting month. Then everyone slept, and 7 a.m, I woke up and I went to the living room just to wait for my mom to have morning tea with her. She woke up horrified. She came running saying that I'm hearing bombings, and initially I thought that my mom is just worried about some fireworks, and I tried to calm her down and telling her that I don't think so, and she told me that she knows the noises. She knows them very well because of where she was born. So yeah, we remember opening the TV, turning the TV on, and there wasn't any indication of any fight. Going to Facebook and seeing people posting the same thing. And the noise was very loud because our house was in a central area and not too far away from where the war started. They started to fight around 15 minutes drive from where we lived.
Gosh.
And then they started to move on to the main street that is only 5 minutes drive from us. So the noises were very loud. And we just stayed in the house, and it kept going on, and airstrikes and lots of uncertainty, but also lots of hope. We hoped that it would end very soon. But as the days went by, then my family urged me to leave because they destroyed the airport, and the only option was to go by bus to one of the cities near one of the borders, and then just go to either Egypt or Saudi Arabia. I went, and my dad drove us, and to the main road. It was very different because we were locked inside the house, so we didn't really see how awful it is outside. Lots of destruction in the neighborhood. Lots of militia forces around, and when you see them, you don't feel safe at all. And it's very heartbreaking because the majority of them are kids. They are kids.
The militia are kids.
The militia, lots of them are kids. I remember before leaving Sudan and during the protests, and after that, when they started to spread in different places in Khartoum, in the hospital that I worked in, used to be near the one of the bases, and it was a fancy hospital, private hospital. They used to come to the hospital requesting medication, and looking at their faces, and they used to carry guns with them everywhere. They used to come to the hospital with a gun, and you look at the face and you look at the gun, you feel like it's confusing. You should be at school, but not carrying a gun. So going back to the war, and then I left. I left to another city that I haven't been to before at that time. Didn't know how to navigate, and before leaving, saying goodbye to my parents and my sibling was a real goodbye. For both of us. We considered all the possibilities, and taking the bus and not knowing where will I be in Port Sudan and what will I do, and passing through lots of checkpoints, and seeing the destruction, seeing blood, seeing people actually pointing guns towards each other. So it was an awful experience. It was a terrible experience. And this, I managed to leave. I managed to escape and I be evacuated from Port Sudan. But Sudan continued on this since April 2023. Millions of people displaced. I don't know a single Sudanese family who are staying in their house. Across all my network, family, relatives, friends, colleagues, no one is at their own house at the moment.
I think that's the thing that's really important to get across to people listening who aren't near Sudan or aren't in Africa, is just the scale of the displacement. It's tens of millions of people. Even now, me saying it's actually hard to wrap my head around that fact. Each individual person has that story that you've just described now, and some of them that they're not as fortunate enough to get out of Sudan. I understand your family did get out. How are they doing now?
I think they are not different from the Sudanese that managed to leave the country, and is different from them compared to me. I left Sudan looking at a better career, better future. I left it by my choice, but they were forced to leave the country. And they never thought that they will be in this position before. Even my father, who is a lawyer, he spent all of his life in Sudan. He used to work in so many international organizations, but based in Sudan. And so for them to adjust, I think it's been taking a while, and they're not fully feeling at home in Egypt. They still feel that there will be a time where they will go back to Sudan, despite the horrible videos that they saw about their house in Sudan, the cars, etc. I feel the psychological impact of the war has been felt in every Sudanese or everyone connected to Sudan, whether in Sudan or outside Sudan. I do have relatives still in the country. Have my cousins, my uncles, aunts, childhood friends, and they are all still in Sudan. And it frightens me what the future for them will be like, and whether I will see them again, whether they will see me again. And it's everyone's experience at this moment. Every Sudanese person is just feeling the same. And I know so many people who actually lost their family members. I know a relative who lost her two brothers innocently. The RSF just killed them because they were helping people, they were giving people food, and they didn't want anyone to help people in the neighborhood. So there are so many horrible stories that happened and happening at the moment in Sudan.
On that point, so the RSF, the Rapid Support Forces, they're the paramilitary, quote-unquote, rebels. So this week, the city of El Fashir in Darfur fell to the Rapid Support Forces, with the Sudanese armed forces eventually leaving. And an already nightmarish situation for Sudan and for the region of Darfur has become incredibly even worse following an 18-month siege. You know, there's satellite imagery showing horrific massacres going on. And the RSF themselves are recording the crimes they're doing. A public health catastrophe is unfolding there. Can you talk to us more about the public health aspect of this and what the impact is on civilians?
It's just disastrous what's happening in Al Fashir at this moment. And as we speak now, the RSF are committing their crimes and atrocities and killing people and competing on the number of people they kill per day and the awful crimes they commit to the elderly, children, women. Public health is around the people, and there are no people left in Darfur now. Around 500 patients were killed in the hospital.
Jeez.
Just at once. The hospital. This was the last hospital in Darfur, and all hospitals are now collapsed. And malnutrition is a definite issue in Darfur. People are starving. People were eating animal feeds for weeks, and now they don't have anything to eat and just dying. So many outbreaks of cholera, measles, leishmaniasis, and many other diseases are there, and no one is able to help. There is nothing to do. No one is able to provide support because of the RSF militia. There is a limited access to clean water, so the situation worsened in the last few days, and the militia is specifically targeting people who are helping people. So they killed so many doctors, they killed so many health workers, so many community volunteers. So these are their targets beside the other civilians.
And that's a compounding factor in the public health crisis as well as obviously destroying hospitals and infrastructure has a profound impact. They're removing the people with the knowledge who would be able to maybe work around not having the infrastructure, that would be able to do sort of evasive action or homemade remedies. Their knowledge is lost now by the specific targeting.
Yeah, unfortunately, yeah, totally agree. And now those who were able to survive managed to leave to another city, Tawila. Tawila is not too far away from Darfur, 60 kilometers.
Relatively safe.
So far, relatively safe. But still, the health system is not strong there. So you can imagine the toll of the diseases, outbreaks, and health conditions that is added to the already fragile place.
And of course, you know, the areas that take the most refugees are the areas right next to the disaster zone.
Absolutely.
And if they were already struggling, if the infrastructure was already struggling, it's not an easy thing to cope with. And we don't know what the effects of that would be. So how is resilience manifesting itself among the Sudanese people?
Yeah, so it's one of, not because I'm Sudanese, or because I know so many Sudanese, even in the very darkest conditions, Sudanese people are very resilient. And this is probably because of the oppression that we have lived in and the hardship that we experienced in the past as well. currently communities are running kitchens. People cook food and they just distribute it to everyone. And they do volunteer for providing basic medical care, and they do support their communities, and they do share resources. And even if they don't have, they try to find something and support in what they can support with.
Mm-hmm.
And especially women. Women are leading so many grassroots in Sudan, and to help people stay alive. And I feel the culture of solidarity is very deeply rooted in Sudan, despite the challenges, despite the war, despite the injustice. We still believe in resilience, and I hope that this will be also something that will get us through the current situation.
So you've recently become chair of Global Health Partnerships Cymru. As the name suggests, it's about connecting people in Wales with people elsewhere in the world to promote good health, and it's rooted in solidarity. How can global organisations, people in Wales, Sudanese diaspora, African diaspora, show solidarity with the people of Sudan? So, you talked about the people in Sudan itself organising these grassroots activities. Is there a way that people can support them and show solidarity?
Global Health Partnerships Cymru has been working around partnerships, collaboration, connection, bidirectional learning, supporting countries in need, and strengthening health system. And there are so many things people can do in Wales, and many forms of solidarity can be shown at the organizations and also at the individual level. The basic and the first thing that I would like everyone to do is to raise awareness, to talk about Sudan, to learn about Sudan and what's happening in Sudan, because Sudanese lives matter. And there are so many Sudanese-led initiatives in the UK, but also in Sudan. I can post these links and send it to you, Pete. If you'd like to share it with the podcast. Advocation for the restoration of humanitarian funding, something that we'll touch on maybe, but that would be super helpful. And I think policy advocacy. We need to talk very loudly about taking the support from the militia. The United Arab Emirates should take the support from militia, shouldn't support the militia to kill the Sudanese people. And we should all say the same. There is strong evidence that showed that UAE is contributing to the war in Sudan through the RSF, and this is not right. This is human right violation, and it's the UAE should stop that. I think we should all speak, and everyone can speak, and people can support financially by providing or donating to those initiatives that I will share with you. Thank you so much, Pete, for asking this question, because sometimes people wonder, how can I support and talk about Sudan, donate and advocate for Sudan.
You touched on it a bit there. This public health catastrophe is happening in a context where America has dismantled its overseas aid program. Earlier this year, Prime Minister Keir Starmer almost halved our overseas aid budget. And in July of this year, overseas aid to Sudan from the UK was cut by nearly 20%. For context, Sudan was a British colony. It's not a random place that the UK has been sending aid to. It is our responsibility. It is a legacy of what the UK has done overseas. What are your thoughts, these cuts to aid and its effect?
It's deeply concerning, and cutting aid while millions of people are facing hunger, displacement, outbreaks, and collapsing hospitals is disastrous, I would say. The UK and other governments must restore and even increase the funding to meet the scale of the crisis in Sudan. As you highlighted in this, and the humanitarian aid must remain neutral, and people must contained despite the complexity of the situation, the political landscape of it. We should always remember that, we are all human beings, and urge all international organizations and governments to support Sudan. And I will mention it again and again to condemn the UAE for their support to the militia, and they should stop supplying the militia with financially and with weapons, and they should stop it.
Well, linked to that, we've heard this week. So at the time of recording, The Guardian has reported that British military equipment, not arms, I should say, has been found on the ground being used by the RSF. So sort of perversely, the UK has got an impact in Sudan, and it's through making the conflict and the violence worse. What would you say to the UK government about its dealings with the UAE and supplying of military equipment?
Yeah, I think this really highlights the complex ways of how international actors can fuel conflict directly or indirectly. I see the UAE is the direct fuel here. The UAE is accused of that, and there are lots of evidences to show that. I would urge the UK to stop supplying the UAE with military equipment, especially those used by them to kill the Sudanese people. And there are definitely lots of ways for the UK to support Sudan, mainly through stopping supplying the UAE with those equipment. And as I mentioned, the humanitarian aid should remain neutral, and we should do all we can to stop the conflict and save people, and stop the war.
I think that's a really important point about how humanitarian aid should remain neutral, because we see a lot in the political discourse about soft power and using aid as a way to achieve foreign policy goals. On the face of it, that is quite cynical, isn't it? And it's
absolutely, yeah.
And the UK government isn't the only government in the UK that provides global solidarity funding. Welsh government provides a small grant for Wales and Africa partnerships. There is a Senedd election coming up next year. What message would you have for parties or the next Welsh government? Would you about the importance of that programme?
I would like to focus on Wales specifically, because this is where I'm based now, what I'm exposed to also as well. I feel very lucky to be exposed to. The Wales in Africa program has been quite successful in supporting so many countries in Africa. And Wales has shown so much solidarity through the Wales in Africa program. I would like the next government to continue on this and even to extend it further, and to support more countries. And we learned that there are so many benefits to the countries, the recipients, but also to Wales. We have noticed and documented the bi-directional learning, how Welsh staff benefit from going to different countries and bringing back the expertise from there and different perspectives, and supporting their organizations in different way, and finding innovative approaches. Sudan is facing the world's largest humanitarian crisis at the moment, and it's not in the headlines. It would be great for governments and the international community to act strictly and decisively on Sudan's matter, to restore and increase the aid. And as I mentioned, Wales and Africa program is not only for one country, but it would be great to have it increase the grant itself to support more countries, and increase Wales' representation at the global stage. Wales is a small country, but has given so much over the years throughout this program and similar initiatives in Wales. So, I would like to see this going on and getting bigger and bigger in the future.
Talking about the future, what gives you hope right now?
Despite the unimaginable, indescribable hardship what give me hope is the resilience of Sudanese people.
It's inspirational, to be fair.
It is, and I keep learning a lot from every Sudanese person I know, especially women. And it's not new to Sudanese women. They led lots of initiatives, and they occupied lots of political spaces back in the days, even before the Omar al-Bashir government. But it's very inspiring to see how people support each other despite the hardship, how neighbors come together to support themselves, and our culture is based on solidarity, and it will remain strong, and I hope that it will continue to go from strength to strength, because I feel this will help us in going through this and recovering, I would say, from this war. And I feel the community kitchens and the volunteer initiatives and sharing resources, even online, just reflect on the scale of solidarity. I'm quite hopeful. I'm so looking forward for this war to end, and the resilience of Sudanese people will make it happen.
Israa Mohammed, diolch yn fawr iawn. Thank you very much.
Diolch yn fawr iawn, Pete. Thank you so much.
And that's it from Wales, Africa and the world. Thank you very much for listening. Thank you to Israa Mohammed for joining us and sharing her invaluable perspectives, insights and experience. If you're working or interested in global health and want to get involved with Isra's work, email cymru@globalhealthpartnerships.org. And for anything else about the international development sector in Wales, accessing support or anything else, get in touch with Hub Cymru Africa via our website, hubcymruafrica.wales. This has been Wales, Africa and the World. Diolch yn fawr iawn. Thank you for listening.